Hey, what's up, everybody? It's Dr. Jason Jones back with another episode of Health Made Easy. I hope your week is going great, and I hope you're doing some super healthy things for yourself and supporting your body and how it naturally and normally heals, functions, and operates. Today, we're going to be talking about the most common spinal disc problems. So, spinal discs, they act like a cushion between the spinal vertebrae, and they create space for the spinal nerves to exit. Spinal discs have a very hard exterior that provides support and enables for a wide range of motion. They can be likened to like a shock absorber for your spine. Pain is felt around the spinal disc as a result of deterioration and breakdown of the spinal disc, which can be very painful. It can be anywhere between being very mildly painful to very severe. And it's super important that when and if you do have any sort of pain and it's disc related, that you get some help to be able to do that. Now, there's some common problems associated with the spinal disc, and we're going to cover a couple of them today. One is a herniated disc, and most of us have heard of this. Studies have shown that herniated disc problems occur as a result of what's called a protrusion of the internal disc material through a small tear in the outside of the disc. So basically, what that means is the jelly stuff in the inside of the disc breaks through the hard outer surface of the disc and starts to move out. And then that protrusion of the spinal disc causes more pain than, let's say, a bulging disc. Herniated discs are certainly a problem, but they can occur among the younger population if there's some sort of trauma. And typically in the older population, it's wear and tear over time, and the outside of the disc breaks down, and then eventually it comes through. Now, the symptoms of a herniated disc sound about like this. So you've got pain in the lower back or the leg, cramping or muscle spasms could be associated, tingling, weakness, or numbness sensation in that affected area. Pain tends to worsen when you sit or lean forward, and a feeling of pain when you cough, sneeze, or you're lifting objects as well. So getting a diagnosis is important. When you see your healthcare provider, your chiropractor, whoever that may be, they need to carry out a very proper diagnosis to determine the main cause. We talk about this all the time. So instead of just treating symptoms and covering up symptoms, you got to determine what the cause is of the herniated disc problem before you carry out any type of care. And I find this fascinating that folks will go and then we'll have an evaluation with whoever the provider is, and for the most part they'll listen to the symptoms and then they'll prescribe some sort of thing without doing an exam, without doing any sort of imaging, without really doing a whole lot of anything. And I just think that's just totally ridiculous. And if you think that's ridiculous, I'm with you. Paying. So when you, let's say you go see your chiropractor, you want to make sure you get a proper physical exam, some imaging, and your chiropractor may refer you out for an MRI depending on, whether or not that's warranted. So if we look at a degenerative disc, or what's called degenerative disc disease, or DDD, degenerative disc disease is a spinal problem that can be responsible for quite a few cases of neck, lower back pain, or pain anywhere along the spine. It occurs as a result of the spinal disc breaking down over time. Degenerative disc disease is common among those who are elderly, but it can happen much earlier in life. According to research, the loss of spinal fluid and cracking of the spinal disc can lead to degenerative disc disease. So, what are the symptoms of degenerative disc disease? Well, they typically are gradual and they increase with time, and they look like pain in the lower back or neck. The feeling of pain restricts certain movements like bending and reaching up. Less pain is felt with walking, lying down, running. So basically, if the person starts to kind of get warmed up a bit, they tend to lessen to some degree, depending on the severity of the degenerative disc disease. Stiffness and restricted movement after being sedentary is also very common. So with a diagnosis, you want to have a detailed history as well as a neurological or physical exam. You want that to be carried out to determine, what is the cause of the degenerative disc disease. Maybe an X-ray, and on an X-ray, you're going to see it. If you can visibly see degeneration on an X-ray, you can be rest assured that's been there for most likely more than 10 years. An MRI or CT are certainly going to give you more data in terms of how it looks on there, but not necessarily better data on how to take care of it, because it is just an image and it's a snapshot in time on what you're looking at. So the symptoms of spinal disc problems can certainly be very painful, and it's super important that you don't take that as sort of what I call a death sentence, meaning you don't. There's nothing you can do. There's tons of things that you can do. You can visit your chiropractor and get your chiropractic adjustments. They can do spinal reconditioning, all kinds of hands-on techniques before you move on to some sort of more invasive type of an issue. There's always more. There's always more conservative things you can do. So I hope this helps. This is Dr. Jason Jones. We're going to sign out on this one today. We've got more on this coming up. Look forward to talking to you guys soon. Have a healthy week. Bye bye.